For my vulnerable population, I chose the LGBT plus community. I hope you enjoy this presentation as much as I enjoyed making it. So my objective for you guys is for you to understand what makes this community vulnerable, learn about some of the social injustices and solutions for them, and to be able to list 3 local resources for this community. So the population, the LGBT community consists of people who are lesbian, gay, bisexual, transgender, questioning or queer, asexual, pansexual, non-binary, and many others. This group spans every ethnicity, age group, social class, and geographic location. So what makes them vulnerable? Well, this community faces discrimination in marriage, adoption, employment, etc. They face bullying in schools and in the workplace. They have a lack of educational resources about their community, and this community tends to self-identify with having poorer health status. This is likely due to the fact that they are at a greater risk for chronic illnesses like HIV and AIDS, STDs, and mental health issues such as depression, anxiety, and suicide. And they are also at a greater risk for substance abuse. So this chart shows how LGBT individuals rank their overall health. As you can see, fewer LGBT members identify as having good or excellent health, and greater use of alcohol and greater instances of obesity than their heterosexual counterparts. This table again also shows that LGBT individuals report higher use of cigarette and alcohol use. It also shows that LGBT individuals report serious mental health distresses at a greater rate than their heterosexual counterparts. So what are some injustices that this group faces? Well, for starters, there are 9 states in this country with laws that prohibit schools from teaching LGBT issues. Those states are highlighted in red on your screen for you. And as I said earlier, this group spans all geographic locations. So these students in these states are not learning about their community and the issues that their community faces. There's a lack of knowledgeable healthcare providers. Healthcare providers aren't taught specific issues that affect LGBT members or necessarily how to interact with these individuals. Anti-discrimination and anti-bullying laws exist. However, there are only a handful of states that have these laws in place, and the number of states that do not have these in place is much greater than those that do. There's also a lack of educational resources for LGBT community due to a lack of research in this area and social stigmatization. So how does this affect access and equity of healthcare? There's often a lack of insurance coverage due to many employers not offering same-sex spousal benefits and just overall high cost of obtaining insurance if you can't get it through your employer. There have been instances where there's been discrimination from providers against this community. There have been providers that refused to treat a patient, or if they did treat them, provided poor quality of care. However, poor quality of care doesn't necessarily mean equal discrimination. It can also be attributed to the lack of knowledgeable providers. And again, this community is at greater risk for chronic illnesses such as STDs, HIV, AIDS, and many mental health issues. These chronic illnesses require multiple trips to a doctor a year and medications that are often very expensive. So this chart shows the percentage of businesses that cover same-sex spouses on health insurance by the number of employees that they have. As you can see, fewer smaller businesses offer coverage for LGBT couples, which leaves the spouses to find their own insurance, which again is very expensive. So access and utilization of services. This graph shows that heterosexuals and LGBT members, many of them were insured. However, as you can see, fewer LGBT individuals were insured than their heterosexual counterparts, while more were uninsured or did not seek out healthcare because of the high cost. So, what solutions do I propose? Expanding education both in schools and for healthcare professionals. Individuals have a right to know what issues that their community faces, and they have a right to educate themselves on those issues. Healthcare providers also need to know how to care for patients, what specifically may affect them, and how to interact with these patients properly. Clinics. I think specialized clinics should exist. There are a few, but they are few and far between. Opening more of them that focus on LGBT health concerns would greatly increase the number of community members' access and use of the healthcare system, and hopefully decrease the rates of these chronic illnesses that they face. Accountability for healthcare professionals. Keeping these providers accountable for the care that they provide would greatly increase the experience these patients have with the system and would encourage them to seek out preventative care and seek out further health care if they were to need it. And finally, research. This is an area that is lacking greatly for this community. There have been great increases in research for HIV and AIDS treatments, but there needs to be more. There also needs to be increased research done in areas of just general health for this community so that they have more educational resources available to them. So local resources for the community include Elder Health Services. They provide primary and preventative care for this community. They have locations in Lancaster and in Harrisburg. Penn Medicine is training their residents in specific LGBT health issues, and they hold a non-discriminatory policy. Planned Parenthood offers screenings for STDs and HIV and offers low-cost reproductive services. And the LGBT Center of Central PA, while not a health services center, this center provides a safe, supportive space for the LGBT community and provides outreach and educational services. These are my references. Please feel free to explore them. Many have links and great educational resources if you're interested. I really hope you guys enjoyed this presentation. Thank you very much.